There are 83 new cases of COVID-19 in the community today, all in Auckland except one in Wellington. But they're not the numbers causing the most alarm. Those numbers are hospitalisations, up by 9 today for a total of 34. That's 33 in Auckland, with 2 in ICU and 1 in Wellington. As for the new cases, experts say it's probably too soon to know if they're beginning to level off. But Dr. Ashley Bloomfield says if we hadn't locked down when we did, we'd look like New South Wales. Alice Wilkins begins our coverage.
Glued to the tally for the daily tally, we've been desperately hoping that number slows.
83 new community cases.
But is this finally it? We might have to keep waiting for the answer.
I think we are seeing a plateau now. It's too soon to know whether cases are going to come down.
Today's 83 cases is just one more than yesterday's total, but another figure has jumped by 9 people overnight, hospitalisations.
At the moment we have 34 people in hospital as a result of this community outbreak.
Worryingly, 30 of them are Pacifica, who are already more at risk for health conditions such as asthma, diabetes and heart disease.
Deeply concerning, and it's the whole reason that we've taken the actions that we have.
Yesterday's cases have also been given more detail. Of the 82, more than 75% were contacts of known cases, and more than 50% were contacts because they live with a positive case. Only 2 of yesterday's positives were considered infectious before we locked down. 25 had exposure events outside the household, but generally at essential work sites that are non-public facing.
They're the cases that matter because they're the ones that create a risk of spreading it on to other people.
The Prime Minister says only 4 workplaces still operating during lockdown have recorded transmission between staff. But if that changes to the rules will be made.
If we need to tighten up our restrictions further, we will.
Looking at the numbers of essential workers, so are there any groups who don't need to go out to work? And the other thing is looking at what people do when they are out at work.
Our 2 major clusters have now grown to 68 and 237, but there's a third location causing concern, AUT.
This is a difficult location to contact trace. Please, if you're connected to AUT, look up the locations of interest.
Dr. Bloomfield has a message for anyone still unsure why we went into lockdown so quickly.
If you look at the modelling from early on about where we would be at now if we hadn't done alert level 4, and the numbers are extraordinary. We would be at New South Wales type numbers by now.
New South Wales type numbers today were 1,218 cases and 6 more deaths. The place where our outbreak came from is no model example.
Well, Alice Wilkins joins us now from outside a location of interest in Auckland. Alice, how many new locations have been named today?
Well, Tom, so far there have only been 6 today, and 5 of those are the location behind me, the Mount Terrace apartments, just named on slightly different times and days. The Prime Minister says that they believe transmission has occurred at 21 of the locations of interest listed, but those locations are certainly slowing down dramatically now.
Alice, thanks for the update.